evening once again. Welcome to Doctor on Call, our usual Tuesday evening program. And this evening we continue with our series on cancer awareness. We have been focusing quite a bit on women's health and cancers that affect women. This evening we have two very special guests with us. Of course, Dr. Nixon is here. She's not a guest. She works with us. I know. Yes, she works with us. And so this evening, I would allow Dr. Nixon to introduce our guests for this evening programs. Dr. Nixon?
So good evening, Grenada. It's really good to be here again as we continue on this trek looking at really becoming aware of the challenges that cancer proves for us in Grenada in particular. We keep saying, 10% of us are going to die from cancer. We're not counting the people who we've lost through coronavirus. And to make it full disclosure here, everybody's in different places, so notice no one is wearing a mask. We're still aware that coronavirus is present and active in our communities. So we're reminding you that when you get into the same space with anybody, you should be wearing a mask, right? Even in your home when there is doubt or suspicion of somebody being infected. So remember this. So please excuse us tonight that we're not wearing masks and you can actually see our lipstick. Cancer continues to be a challenge to us, to Grenada, and with our health budget as challenged as it is in every other way, especially in other chronic diseases like hypertension and diabetes and all the complications, visual loss, limb loss, kidney failure, etc., the cost of medications, the cost of rehabilitation, nothing. We need to take into hand those that we have control over. We know that if we practice certain lifestyles, if we have certain behaviors, if there are things we do for early diagnosis, that we can prevent death. Because our objective at the end of the day is to prevent death by cancers. What is it about us? We don't know, but we know that cancer has family relations. We know that behaviors like alcohol and smoking and poor diet and obesity, etc. We know that gender in the case of women's cancers. We know gender in the case of prostate cancers and other things that predispose us. We know hormonal use, etc. What we're trying to do tonight, however, is to look as we continue on closing the gap. The gap to screening, the gaps to diagnosis, the gaps to treatment, the gaps to support, the gaps to survivability, the gaps to reincorporation into life, the gaps to care at the end of life. All of those things come in as challenges. What are the things that are missing? What can we do? Tonight, we have two very special guests, and what we want to look at is how are we going to close that gap in education and the gap in early diagnosis and making people understand why they should do this, why they should go and look and make sure. And I always say screening is people going and look, move the curtain and see what is there. Maybe it's there, it's just starting to shine, we deal with it. It's been there for a while, we can deal with it still. But the earlier we start with screening, the more we understand, the more we seek education, and the more we use this for the right reason than for simply TikToking. Go in and you have a doubt, just Google it, trust me, it's all there. Even we go to Google sometimes when we have our doubts. So if we can close that gap, right, we have more people screening, earlier diagnosis, better life, better quality of life, better family life, better outcomes in general, longer life, because we still want to live up to 75, 76, 80. That's what we want to get as women, and 79 for our men, which is still a long way. They're still long at 71 years for life expectancy. Tonight we have two very special guests who are, I know from having worked with them, who are passionate about what they do in women's health, especially when it comes to preserving the quality of life that a woman can have. Women as center of our families. Tonight we have Dr. McIntosh, who's no stranger to us. Funny, I was just teasing because both of them have Karaku links. So Karaku is in the house tonight. Welcome, Karaku, and I hope our brethren in Karaku are listening to the paisanos talking tonight. Dr. McIntosh is currently known as the director of, what's it called, Dr. McIntosh?
Hospital services.
Hospital services, but I know her as a gynecologist obstetrician with a lot of passion for women's health, the things that have to do with reproduction and just women's health issues. And women's health issues, yes, go beyond cancer and breast and cervix. It takes into consideration the entirety of a woman's well-being. So Dr. McIntosh is a very well-known, very erudite, and very experienced practitioner as a gynecologist, but her public health outlook, how she looks, how does this benefit large populations in relation to women's health is of no mean order. And so tonight she's going to talk to us specifically about the screening program she has led, how they've integrated women's health in a whole way, in a very holistic way. And then we have Marva, Primus-Joseph, a nurse educator, a passionate public health practitioner who just recently reopened Grenada Planned Parenthood Association. You know, I remember as a child, Planned Parenthood was called, they just went for a pill to not get pregnant and probably sign up to get a TL, a tubal ligation. But Planned Parenthood, again, has taken a very global and a very holistic, very widened view into women's health. Yes, reproductive health, but generally in women's health. And so Ms. Primus will share with us what they're doing and how they relate with the rest of the community. And Dr. McIntosh will tell us how they relate with the health services or general health services in relation to preserving women's health, and particularly cancers that affect our women, and how we can come together as a country to ensure that we can cut down those numbers to 1%. And so I'm going to let you ladies take the lead. Dr. McIntosh, since you're, big girls go first, right? So since you're the bigger girl here,
depends on how big big is, but
you're still bigger than her. So where we will look at it. You're still big. But I'm going to ask you to take the lead and just give us an overview of what your work has been and what your dream in particular has been for Grenada. Later on, we'll talk about what we've been doing. But tell me what your work has been and what your dream is, how you've been able to translate the experience you've had working in North America for all these years to try and make Grenada's situation a little more tenable, a little easier, and that there's more light in our eyes and more practice in our behaviors.
Well, first, let me say thank you. Thank you, Dr. Nixon, for having me, and Mr. Godfrey as well. And I think even before starting, you talk about us coming in and doing the work of trying to improve the health, but simply this is one of the key ways that's going, where it's actually making people educated, coming into another forum to be able to make people aware. And this is one thing that Nixon, you're always doing, in making people aware, because that's the first thing. Education and awareness is the first tool or the first weapon that we have against different types of diseases, and in particular cancer. I know you're asking, and Mr. Godfrey, before I go on as well, your being here as a male is also important, because it really makes people start to understand that it's not women talking about women. It is women, yes, we are women talking about women's care, but all of us, it affects and interacts with all of us, as yourself in the sense of having a significant other, mother, sister, and aunt, etc., but also as yourself in the sense of saying, yes, this is my fellow, because she was made from my rib. This is my companion. So how do I help? Because that also helps me as well. Now, I don't know, that's Nixon. You asking me what, I've been coming back and forth to Grenada since 1993, and I want people to age me, but this is my passion simply. And, someone stopped me in that of understanding Grenada, Carriacou, and Petit Martinique are my passion because of my parents. Because if they themselves did not hail from here, I would not have known of Grenada, and probably would not have stepped foot in unless I heard about Grand Anse or something like that as a tourist. So I really want to stop to pay homage. My father died just last year, and he's buried in Carriacou. And I just stop and think about it's because of them, because of the heritage is what brought me here to start with. And so really I pay homage to them as to why I'm here. What do I do? You said it. I love OBGYN. I love it. I love it. I mean, that's what I know. That's what I do. And yes, I'm director of hospital services, but what I know is OBGYN. And that's what I love doing. And I can always fall back into that at all times. And the thing is, it's the love of medicine, the love of caring for people, taking care of people. I love surgery as well. Don't get me wrong, that I can go into the OR at any time. But it's also knowing, and my faith brings me to this, is that the woman's body is beautiful. It's wonderfully and fearfully made. And I put this forth in that sense that we are unbelievable in how we are. And so it is amazing, even no matter how many times we deliver a baby, each time is amazing. And the process for it. No matter how many times I sit with a woman and she starts telling me about her care, it's that you stop and think about how beautiful we all are. And that includes men as well. Don't think that I'm just saying that. But just that understanding, and then really being able to watch that and know us as a temple, and then to know us as having health. How do we improve our health? And my thing is, it's not me that's improving your health. It's me working in partnership with you and providing the education for you to be able to take control. Because I believe so much in the fact of empowerment, that we empower every single person. And it doesn't matter how old, how young, how rich, how poor, how dark, how big, how full, none of that. If you are able to say, I am going to take care of me, and I need to make sure that I have all of my partners there, doctors, nurses, even educators, how do I get to that point? Then that's key. So that's just in the broad thing. And that even allows me within as director of hospital services, it is again, to recognize I am not the one that's taking care of the hospital. I'm the one that's helping to bring together all the different people, and that's at all levels, those on the ground and those in the ministry. How do we all work together towards our common goal? And what is the common goal for the Ministry of Health? Sustainable, excellent health care for all people of Grenada, Carriacou, and PT Martinique. So that's just an extension of what I like to do.
Thank you.
Dr. McIntosh, let me just butt in here. We're still in a pandemic. A little, we're in a better place now than we were probably, 6-7 months ago. During that time, we were at home. We couldn't get out, and it was a very difficult period. That did not prevent, aside from COVID-19, the chronic conditions from affecting many of us. And so some people were not able to get the care that they needed. They were able to do a thing or two, but not able to get the care that they needed. From this situation and where we are now, the importance of screening, the importance of people understanding what they need to do, taking that personal responsibility to ensure that they live as healthy as possible. Let's talk a little bit about that, the importance of screening, and educating our people.
Yes, I'm glad you pointed that out, and Dr. Nixon had also drawn to that. With COVID came in and hit us on so many levels. COVID hit us directly in the sense of it causing death, it causing illness. And we were fortunate in the sense of Grenada, with the government really recognizing that as quickly as possible, and how do we say the lockdown, doing all the different things that were put in place to kind of decrease the spread. But we were not affected. You are absolutely right. With the lockdown, what caused it is that people said, I'm going to stay home. And then they can't get into the clinics as well because most of the time it's overrun by people with the symptoms. Mm-hmm. And so and then also within the hospital, our hospital went up to like 60, half the hospital was COVID patients as opposed to patients with other diseases. And the other diseases did not stop. In fact, some of them were actually pushed by COVID because COVID itself loved the fact of diabetes. And if you had diabetes or overweight, it's like, I'm going to hit you and I'm going to hit you hard. The screening lessened simply because people were scared, fearful of coming out because they said, oh my God, if I go to the hospital, I might get COVID. fearful because the health center may have been closed, or I'm hearing that someone, when they go there, I don't know who has it or not. And so you have the fear of not wanting to go out and you're going to get COVID. And on top of that, you're now staying home. So you're not seeing your doctor. You're not getting the screening for blood pressure, screening for sugar, and you're not getting the access to your medications. And you may be saying, I can't get out there, so I don't know. And then the women, when we talk about screening, we talk about the pap smear and we talk about the BIA screening. But then we also talk about if you're postmenopausal and you notice some bleeding. You may think, is that my period? No, it's not. But I'm fearful about going out. And so the symptoms that start to occur early enough that if we catch it in time can help us to maybe stop the trend toward cancer, or at least address it and treat it and be able to cure it. Those were missed. And it's not just here in Grenada. That was across the world, where they noticed a spike up in different types of cancers where people are coming out. And then even if they're coming out, they were not getting the care because majority was was spread to that. So it was very difficult, and it still is very difficult, because we're now on the other end. When we stopped saying we saw less COVID, but then we saw more people with uncontrolled hypertension, uncontrolled diabetes, and those, even in just themselves, can cause problems. But a woman of color, a little bit on the larger side, which is a lot of us, because we got a nice little weight, diabetes, postmenopausal, that's the definition towards endometrial cancer or uterine cancer. And so how do you help that? Well, this is here, right here. This is where you start. But in the screening, it is really that empowerment of saying, even though I am scared, I'm still going to go and try to take care of me. I still got to go out there. Let me wear my mask. Let me sanitize. But I'm going to go because I can't stop living. And that's one of the things we need to remember. COVID may come in here, but it should not stop us from living. And how do we continue? And so, I'll go further into more like the screening that this Marva Primus as well will talk about. But there's a lot of different things that can be done in the center screening. Screening is not simply coming to the health center and to get your pap smear and doing the breast exam. Screening is understanding, how is my body? Every day my body does the normal thing. Something is abnormal. I need to go into a healthcare provider. That's screening. Preventative care is, let me go in and have my regular checkups before anything happens so that I can stop it before, or recognize it before it gets out of hand.
Dr. McIntosh, listening to you, this last few words that you said, I'm getting the feeling that an important part of screening is someone actually paying attention to themselves and observing what is happening.
Right, exactly. And if we talk women, and and those who know me know I just go blunt. I am not. I tell women, take off your clothes, look at your body. It is a temple. May not like a little bit breast and a little bit extra butt, but it is your body. Love yourself and know yourself, and know how it is, and know what is normal and what is not normal. So once you know your body, you are bringing that into the doctor. Once you know who you are, once you know, and you can ask a woman, when did you ovulate? Oh, girl, I know that because I know when I get this little kind of sticky discharge, that's ovulation. When was your last period? Well, I went shopping and
Okay, I think we sort of lost Dr. McIntosh for a minute there. I hope she can rejoin us. And folks, that's one of the little drawbacks of using the virtual platform. But I think we've she's back. Yeah. Dr. McIntosh, you're back with us. Yes.
So normally I'm fine, but I noticed that when I went to the bathroom, I had some blood in the stool or in the toilet. That's where we start to say that screening. This is how we start to know. You look at what normal is, and you are the only one that knows normal for yourself, and when it stops being normal. something is not correct. Just go get it checked.
Okay, wonderful. Dr. Nixon, you want to come in here before we go to Mrs. Joseph?
No, I want to get Mrs. Joseph in. Call me Mrs. Joseph. You know that song?
Oh yes. It's called Social Bacchanal.
Oh my.
No, I want to get Mrs. Joseph in because I think let's look and see what we have. I listened to Dr. McIntosh and so correctly saying that we need to be our own screeners. We need to understand our bodies. Mm-hmm. But there's that bigger gap that we've had. The whole thing about ongoing education. COVID seemed to have just blocked out everything, while those of us who normally give education try to stick your head in the window a little and say, hey, remember that? Oh, you can see what they want. There's COVID out there. I'm not going anywhere. And sadly, one of the bigger challenges to this whole process of going out, and even if you're converted, you understand that you need to go out. The fact that our complement of caregivers is still lacking in some way, and they had to be mobilized to deal with a crisis, because that is what was most important. And I'm hearing Dr. McIntosh saying, look, let's not forget what we still have to do. We lost 2 years, we're not losing a third. Let's all make sure that we empower ourselves, because really and truly what all of this is about, women becoming empowered to take care of their bodies, to understand what it's all about and to take care of it. But before we finish talk for the whole night, we're going to introduce Mrs. Joseph, who I'm sure has a lot to say. With the passion she has brought to the Planned Parenthood, let's listen to what happened, because Planned Parenthood has been away for a little while, huh? Mm-hmm. And now you're back. Now you're back on the front burner and offering services that helps to fill all of these gaps. You out there, you're ready to educate, ready to go out into the community. Tell us what's happening at Planned Parenthood, and welcome to this program.
Good evening, and thank you to Dr. Nixon, and thank you to Godfrey for having me. Yes, I am very passionate about women's health. Rather, I have invested some time for research in that area, looking at the services and the quality of services that is available for Grenadian women, and also how the practitioners felt about what is available. That was not only done in Grenada, it was done in the Windward Islands also. So we were doing some work in regards to education and preventative aspect before even joining GPPA. So I can share that there is this program that was one woman to woman, where we were teaching lay health advisors how to go about in the different communities to teach about women about, okay, what is a pap smear about the body and what happens when the changes occur, what signs they should look for. And I must say this was very, very effective, because it wasn't necessary they were health professionals prior. They had no experience in health, but they were able to go out there using a flip chart that was designed specifically for that purpose, to go out in their communities, the churches, whatever, and teach. There's a number of persons that they did the teaching for. And that stemmed from the research. It showed that a lot of persons, women, was scared was just to have a pap smear because of myths or what they would have heard. Some of them never did it. They heard about this metal and this iron and how it's uncomfortable. And it's not just in Grenada, that was common among the other Windward Islands. So that was why the Woman to Woman project was instituted, and it was very successful. So being the executive director at GPPA, I can take that program further to make sure that more women get access to that information using that same flip chart that was designed. So then you can take away the fear and give them the power with information, so they would make that informed decision. So I must say, GPPA being back and open to serve the public, we have conducted 143 PAPS tests since we opened from October to now. So it tells you that within the 2-year period when COVID was a priority and it was what needed to be dealt with, persons mentioned they did not have a pap smear done because GPPA was closed or they wasn't able to access. So we had 143 persons come to get pap smears from October to this time. For the population of Grenada, that is significant for the time period, and we are encouraging persons to come because we say to persons, the earlier you catch it, it is less invasive in terms of going through the different treatment modalities. Also, it is cheaper and less what you would call, it's in terms of, well, we're not a rich country, so preventative is always what GPPA will be pushing, and that's what our services aim to do, to try to make persons, get them catch it very early and provide that service so they will be able, comfortable to, go through the whatever diagnosis or whatever test that the results that they have that support from GPPA.
Okay, wonderful. Doc, we need to take a short commercial break. When we come back, I have a question. Probably Dr. McIntosh or Mrs. Joseph can take it. But let's take a short break and I'll be back with you in just a moment. Stay with us. Don't go away.
When you need your prescription filled or you require non-prescribed medication, supplements, or all your personal needs, visit Gittins Healthcare at locations on Wall Street, Grandans, Victoria Street, Granville, and Central Deputy Street, Wharf. Gittins Healthcare aims to provide an exceptional personalized pharmacy experience. Additionally, children under 5 and adults 55 years and over will enjoy 10% discount on purchases of $20 and over on prescription medication. Stop settling for less. Visit Gittins Healthcare, where your health is our priority.
When a loved one passes on, we all need the comfort, support, and guidance of a trusted friend. You can rely on LaCour Brothers Funeral Home. We provide a personalized professional service that exceeds all expectations. Our dedicated staff responds to your every need with the greatest detail, ensuring affordability with a variety of options. Upgraded state-of-the-art facilities, spacious air-conditioned chapel with live internet streaming, a modern, environmentally safe crematorium, the only of its kind on island, private viewing spaces, large on-site repast center, a modern transportation fleet. Join our burial society today and make personalized arrangements for that final moment. As you prepare to enter your loved one into eternal rest, visit or call LaCour Brothers Funeral Home and select a package that brings added comfort to the entire family. LaCour Brothers Funeral Home and Burial Society, continuing a tradition of excellence.
Get away from your daily stress with a Grenada vacation at the Coyaba Beach Resort. Coyaba is located on the world-famous Granans Beach and boasts 5.5 acres of beautiful garden. We offer excellent service, good food and drink, well-appointed rooms and friendly staff in a safe environment. Facilities include 2 restaurants, 2 bars, swimming pool, water sports, tennis, gym, and body treatment rooms. Call 473-444-4129.
The Nawasa app brings the power of Nawasa's customer service experience to you. Instant, conversational, and smart. Easy access anywhere. Get bill balance, transaction history for up to 6 months, report a fault, link to websites, view payment centers, contact information, push notifications, and multi-tenant accounts, all in a secure login platform. Like a self-service concierge app, mobile.nawasa.gd gets you the support you need much faster. Available on both Android and iOS platforms. Mobile.nawasa.gd, your customer support companion. Nawasa, committed to meeting customers' needs.
Introduce support you at every stage of your life.
For business,
for your education,
for your financial freedom,
for that new ride.
Upgrade your life with the Communal. Contact us today.
Get ready for a season of Grooving Smooth and Live on GBN. Grooving Smooth and Live is a 1-hour performance gig every Thursday from 8 p.m. featuring performances from our local musicians and short interviews discussing all things musical. Every Thursday, a different musician and a different instrument will be featured, from the violin to the saxophone to the trumpet, guitar, and steel pan. Our local musicians playing, improvising, and educating us on all genres of music. Join GBN with host musicians Matthias and Shireen and a special guest every Thursday at 8 p.m. It's Grooving Smooth and Live on GBN.
Welcome back, everyone. It's Doctor on Call, and those of you just joining us, we welcome you. I have a question, and maybe I should direct it to Mrs. Joseph first, and then Dr. McIntosh, you can probably coming after. Mrs. Joseph, you spoke about your program, the Woman to Woman, and it's a fantastic idea. But my question, look, just the thought of going to a doctor or going to the hospital to do a test, and the thought of your results showing you that, hey, something is wrong, that is scary. We are humans. It is scary. How do you get someone to override or overcome that fear and said, you know what, whether it's negative or positive or good or bad, I am going and get tested? But I can guarantee you that fear will somewhere, whether even if it's a very small percentage, will override that push or that urge to go get tested. How do you help a patient to get over that?
Well, this year will be 28 years in nursing. I can tell you I have met those patients, and it's real, but we have to be mindful that we have to address persons, assess and offer them based on their needs. Persons are made up of mind, body, and soul. So one, you must understand the fear is real, and identifying what is causing the fear, then you'll be able to, let's say, educate them, give them some information, because with information, that can take away some of the fear. I personally, and I will share my experience with others, that whenever I do a test, I do not worry about it. When the results come, I'm going to deal with it. But we have clients who, the moment they do that test, they worry until the result is available. Can you imagine worrying up to, let's say if you take a month to get your PAPS result, what that does to your body, psychologically, physically? So you say to the person, you are making the right decision to come and get screened. In doing that, if there is possible, you may not have anything. So you worry and you worry for nothing. So when the results come, we will sit you down. We will provide that really relaxing, environment. If you the provider would know if it is a negative thing, you make sure you set the conditions right. Look at your tone of voice, your body language. Offer them some water, have a glass of some napkins, and you say to persons, Some persons like, just give me the results. Don't delay, don't drag. You say, how do you prefer to get your results? Do you want to take a step-by-step process, or you just want to know the result? So based on what they say, you go with what they say, and you just try to understand your clients and you work with it. But offering that empathetic and very, look at your body language, you show some, that you understand what they are going through, but also taking that time to show them what they can do. So that can reverse and realize, oh, we catch it early. These are my options. Okay, I am ready to move to the other level. So to me, it takes that kind of relationship with your clients. So be the person come to GPPA, go to your private doctor, whichever setting, this is supposed to be the approach, because you are dealing with humans. And some persons just come in to get a test or come into a health setting. You call it, they get the physician, doctor's high blood pressure. The pressure will just go up once in a health setting. But you try to find, that's how your pressure is, or because you come to the health or you're expecting a result, then you realize, and you just offer some reassurance. That's generally how we will do it.
Dr. McIntosh, I'm sure you want to come in here.
But before we move on in relation to that, you see, because doing screening is not just go up there, I want to do a pap smear. Remember, there's a lot of preparation, education. That's why education is so important. That's why we have to close the gap on knowledge, so that when a woman comes for a pap smear, she knows, guess what? I cannot change what my pap smear results will be. I'm just making sure that nothing is wrong in there. So once we are able to offer constant information, it is important that women are empowered. So when she comes to a pap smear, I have one who come to me and say, Lord, I need to do a pap smear. 2 years, no. Can you imagine Dr. Nixon, 2 years, And so she's a convert. And you remind her to tell another sister who speaks her language, her own sister, the person in her office, her mother, her friends, right? Somebody who just go to church with, whatever it is. But education, that's the role of education. And tonight I'd hoped we'd have had somebody from health promotion, because that is where it has to come to help to obliterate the fear. So when they finally get to GPPA or Dr. McIntosh's office or the gynae office or the nurse in the clinic, wherever they go for services, they already understand that, look, is it yay or nay? Let me make sure is nay. I'm good. Okay? And if it is nay, if it is yay, if it is yes, I have a challenge. I come here so early that I know that I have that challenge under control. So those are the things we want to get women to think, in that going to get a pap smear is not to hand you your death sentence. It's to make sure that you're good.
Dr. McIntosh?
As everyone is saying, that's exactly it. And one of the things that people come in and they're fearful. And we're fearful because it's the unknown. And so we always have to try to remember, fear comes because we don't know what's going on, and we make the story. When you know, it's like, okay, well, now I know, and what do I do about it? So as Primus was saying, it's to listen. That's our key thing as physicians and as nurses and as healthcare providers, is to listen. Listen to the person, and you will hear how you need to respond. The other thing as well is to provide that information, but tell the person, no matter what the results, bring another person with you when you come for your results. Do not come alone, because you're coming in and you will hear your results, but you need someone there who's going to hear the doctor speaking. And it really does come to, because sometimes people are here, you have cancer. They have shut down. They cannot hear anything more. And you have to deal with that, but you also need to tell them what the next steps are. So that's why you want that person there that will be able to lean on, listen for you while you're hearing this and you're trying to take it in, because you're not going to take in everything. I myself, as a physician, I'm a hypochondriac. Let's just say that. So for me, I need to always bring somebody when I go to the doctor, because you're going to tell me something and I'm listening to you as a patient. I'm not listening to you as a doctor, because if I do, I will take it all the way there, because I have too much knowledge in my head and I'm going to bring it. So we want to address the fear by just that. And Dr. Nixon, I'm going to correct you there. You don't need a health promotions person to come in. You are doing the health promotions right now. Every single time that you have this program, you can't do it any better. It's you going right into the person's house. You're speaking to them on their own level. That's what we need. So we are doing that. And so with the same thing of when you know you're going back in for your results and you're agitated, bring it back down. Because it's like, let me hear this. Let me hear what it is. And I know if it's going to be a battle, well, let me get my tools together and understand that the person who is telling you is part of your war, is part of your team that's going to fight that. And if it's not a battle, then it's like, hurrah, what can I continue to do to make sure for the next year that I still come in and have these good things? So that even if something does come up, as Ms. Primus said, you catch it early, you can treat it early, you can manage it. And in fact, even before catching it, if you can prevent it, that's even better. Yeah. So it is, one, understanding that fear is usually because of the unknown. So address it. Two, no matter what, bring somebody with you to the doctor or to the healthcare provider. If it's nothing else, you have a long wait, you got someone to talk to. But also while you're sitting there, when you go in, you may only hear some of the things that this person can come. And then also have your questions written down. Because sometimes when you're right in front, not only your blood pressure goes up, but things shoot out of your head and you don't remember what you want to say. And then for us as healthcare providers to the person, you know, when I was back in medical school, one of the, when they asked, what's the best doctor? The best doctor is one that knows to say, I don't know, and I need to get help. And the second thing is, how do I treat a patient? Because we can't teach you how to have bedside manner. That is not something that can be taught. It is learned. And one of the things is simply, when you look at the person across from you, if that was your mother or your brother or your cousin, how would you want them spoken to? That's your bedside. That's for us as providers. That gives you the best way of being able to say, how do I tell this person what's going on? If that was my mother, I know I'm going to tell her in a particular way because she's not going to understand the medical terms. And I know she's going to get fearful. So I know I got to deal with it this way. So if we keep that in mind, that also helps us, because it's not only the person that's receiving the information, it's the person that's giving the information. How do we manage with that?
Okay, wonderful indeed. Mrs. Joseph, anything you want to add in before we move on?
I just want to remind women out there, and both doctors will agree with me, the cells of the cervix take years, a long time to change. So there's ample time to get a pap smear and catch it, or to know exactly what's happening. So let's take the fear of the speculum with the metal plastic or what you're here, and just say, okay, so women who already done pap smear, I kind of use this forum to speak to a sister, friend, to encourage them, listen, let's go get it. Make body appointments. So right. We need to look out for one another. And yes, it doesn't take very long. And GPPA, you won't have to wait a month to get your you get your results in less than 2 weeks maximum.
Mm-hmm. Okay. Let me
just add one thing.
Sure.
One thing, just with the pap smear, is exactly that. Because you hear about the speculum or the clamps and et cetera. I'm going to give a little tidbit for women that are coming in. First, obviously, you make sure you're coming in for your pap smear. While you're having it, ask the doctor to let you know what he or she is doing, or the nurse to let you know. As they're placing the speculum, a little tidbit, bear down like you're on the toilet, like you're constipated. That will help to relax the vaginal muscles and allow for the speculum to not be as difficult in getting in. So that's one base thing. But then the other thing, besides the pap smear, we also now have what's called VIA, visual inspection with acetic acid, or what we call table vinegar, which is another one where it's an immediate evaluation of the cervix, which is the mouth to the uterus, and that you see in the vagina, and we'll be able to tell you if everything is okay, and if not, perhaps have treatment done at that point. So you can have the pap smear, which can be done, again, we talk about the HPV, and have them wait for the results and then move from there, or the VIA, where you can have one-stop medicine in a sense.
Okay. Dr. McIntosh, the VIA that you just spoke of, is it available here? Is that
Yes, it is. humbled or proud in the fact of saying that we were able to train nurses who are in the community health centers to do BIA. So they were trained under the Johns Hopkins standard certification for it. And basically, it's at 3 clinics right now. It's in Grand Bras and St. Andrews. They offer, there's 2 nurses that are there, Nurse Bugmeyer and Nurse Rennie. And then it's also offered at Sortier's Health Center up in St. Patrick's. Nurse Stafford offers that, provides it there. And it's in Carriacou, P.T. Martin. No, Nurse DeClark who offers that as well. So yes, it's at this present time, and our Chief Community Health Nurse, Sister Charles Telesford, is also, garnering up to say, let us train more nurses so we can start to provide it in Grand Anse and St. George's as well.
Okay, and I saw the joy in your face, Dr. McIntosh, when you mentioned Carrick. Well, I'm very happy for that. No, this is serious. It is serious because a lot of time, I think not enough attention is given to Carriacou. Even the mentioning of Carriacou is definitely not enough. So I'm really happy, to hear that service is available there.
So before we go on, Mrs. Joseph,
yes,
they have been offering GPP, Grenada Planned Parenthood, has been offering not only Pap Smears, but
we also have VIA and
so St. George's is basically serviced as well,
and also cryotherapy.
And cryotherapy. So, one of the things that we have, you do yours, everybody does what they does. We have to move to that point of integrative care from services and integrative care from partnerships standpoint. Because, here I'm going to start to talk as Cancer Society. We have a screening vehicle that we can take anywhere, that we can carry. It was built, hopefully we want to take it to nooks and crannies. And we know that part of the population that is left out, again, we're talking about gaps, right? Part of the population that's left out are the women who live in rural districts, women who have agrarian lifestyles. They get up early in the morning and they go on the bush. By the time they come out from the bush, they have to cook food for the children that come from school. So that access to care that normally starts earlier in the health centers is not as accessible, is not as readily available. And so the truth is our health services have to go out to meet women and people in our community wherever they are. We're only 133 square miles. I mean, we really just have a little town, just have mountains in between us. We have to facilitate people's access to care. That is one of the responsibilities. And I know Dr. McIntosh and I we're having this discussion today, as well as Mrs. Joseph and I have spoken about this many times. Just need to get on our feet, get off our tails, and get up there and start meeting people. Start relating to those community groups that really can tell us where the needs are, where people are, and work with them. Because we do have the professional services, we have the physical ability, we can get there. It's just get people in. We are educating them through this, and through the churches, through whatever it is, we're going to get there. We have to get there because we have to change the bad statistics we have. We have to close the gap in on access to care. We have to close the gap in on behaviors. We have to encourage women in the community for whom we do PAPs to encourage their daughters to ensure that their daughters get the HPV vaccine, which prevents cancer. So that kind of integrated care is what we have to aim for, which we are going to be aiming for in 2020. This is not going to be 2020 as well for this. It's going to be 2022, okay? We are getting over there so that we can use all these resources. We have knowledge, we have ability, and above all, I think the agencies that work have the drive, and that is very, very important. Okay, so I might I will use my favorite corner, legal piece, and see 10 women, but that's 10 women more than not. Okay, that's 10 women. Mrs. Marva is talking about having done 137 women. If you live in communities where Carol and I live, we probably like 137. But the truth is, it's 137 more than zero. Right? We have to step away from zero and get our statistics moving. The only thing that we should aim towards zero is death and disability from cancers, over which we have so much knowledge and control.
Okay. One last question before we move on, as it relates to Pap smear. Is there a specific age range within which a woman can get a Pap smear, or it's open?
So it would start. We recommend that all women come into the gynecologist starting at the age of 21 or 3 years after becoming sexually active. And even after becoming sexually active, even as becoming, you should still come into your gynecologist, even if it's just for birth control. But 3 years after sexual activity or 21 is when you start to have your first Pap smear. And on top of that, now you're hearing about HPV, and you want to know, can we do the HPV typing along with that? Because let me just back up. Cervical cancer is the number one killer in the people of third world countries. Still, unfortunately, when we have all these screenings to catch it when it's in its precancerous low, we're not. And so we have HPV, the human papillomavirus, which is a cervical cancer preventer. It's very simple as that. 70 to 80% of all cervical cancers have been shown to have the HPV 16 and 18, because we number them. And HPV makes warts in the hands, in the genital area, and it can make abnormal cells. So when we say it is necessary in the sense of doing the Pap smear, it helps you start at 21, as we said, regardless of whether you're sexually active or not, because at that point, the cells on the cervix have started to change, and if they've been exposed, can have abnormalities that you can pick up early, and that's what we want. Pap smear is not to pick up cancer, not at all. The Pap smear is a screening test to pick up pre-cancerous lesions, pre-malignant lesions, lesions that if you do absolutely nothing for 10 to 12 years, sometimes a little bit earlier, will become cancerous. And so we do that. We can treat, stop that path, and cure you, stop you from even getting cancer. So that's with the Pap smear. Then people will ask, well, when do you stop? Probably when you're in the grave. That's when you stop doing Pap smear, as far as I'm concerned. Because, they used to say after 65, but I'm sorry, women are sexually active after 65. We don't stop after that. So it is, as long as you're still active, yes, still getting the Pap smear. If I remove my uterus in the cervix, should I still get it? It depends. If you have cervical cancer and had surgery for that, then yes, you still want to do the Pap smear because it's a potential that it can come across the vagina. So with a Pap smear, it is 21 or 3 years after becoming sexually active, and there is no judgment here, none whatsoever. It should not, and that should not worry you, because you are empowered to be who you are and to continue as long as you're sexually active. Or if you're not sexually active and you're hitting your 80s and all, then you want to have a negative Pap smear with HPV. If you have a few of those, then they say there's a point where you can stop doing it.
Okay, wonderful. So I need to take my final commercial break, and then we'll come back. I want to ask you quickly about some other types of cancer that affect women, ovarian cancer, and then we will get our public to open our telephone line so they can, if they have any questions, they can definitely share it with us. So stay with us. We'll be back in just a moment.
We often take mobility for granted. That is why at the Grenada Physiotherapy Limited, we look after our patients' holistic well-being. We assess and treat from the simplest to the most complex complaints. Treating injury is not our only focus. We have a passionate team and a wide array of practitioners working together to assist you through that rehabilitation process. We offer a wide range of services: speech, massage and physiotherapy, weight management, cardiac rehabilitation, and much more. Call and make an appointment today, 435-8000, or visit us downstairs the National Cricket Stadium, gate 101-115.
If there was ever a time to keep and stay healthy, it's now. We at Hills and Valley are here to help you take deliberate steps to maintain your health. We stayed true to maintaining the most comprehensive rates while stocking the widest range of medicines and health devices, including personal protective equipment. There are so many benefits shopping with us. You get great savings through discounts for senior citizens and reward cards for loyal customers. Ask about owning yours today. Visit us at Halifax and Grenville Street, St. George, Jubilee Street opposite the Grenville Bus Terminal, and at Hillsborough, Carrico. Our wholesale distribution on Halifax Street also stocks the widest range of pharmaceuticals. We are with you on the hills and in the valleys. We are Hills and Valley Pharmacy.
Here is a little known fact. There is only one place in Grenada that you can get an MRI scan done. That place is Spicile Imaging Center. Yes, Grenada, that's the truth. Other centers could offer you other scans, but Spicile Imaging provides an authentic MRI scan. Here's another little known fact. Spicile Imaging has 3 centers. We operate at Grenville, the Carnage, and at the Ocean House, Grandlands. We provide the widest range of laboratory tests and services. CT scans, x-rays, mammograms, ultrasounds, and a host of other services. We are fully staffed by a team of family doctors and specialists. Call us today at 444-7679 or 406-1500 or visit any of our 3 locations. Spicile Imaging, from seeing the doctor to getting lab tests, scans, and pharmacy services. We are here to take care of you.
When a loved one passes on, we all need the comfort, support, and guidance of a trusted friend. You can rely on LaCour Brothers Funeral Home. We provide a personalized professional service that exceeds all expectations. Our dedicated staff responds to your every need with the greatest detail, ensuring affordability with a variety of options. Our upgraded state-of-the-art facilities, spacious air-conditioned chapel with live internet streaming, a modern, environmentally safe crematorium, the only of its kind on island, private viewing spaces, large on-site repast center, a modern transportation fleet. Join our burial society today and make personalized arrangements for that final moment. As you prepare to enter your loved one into eternal rest, visit or call LaCour Brothers Funeral Home and select a package that brings added comfort to the entire family. LaCour Brothers Funeral Home and Burial Society, continuing a tradition of excellence.
Level of convenience and comfort awaits you when you shop at Rise and Shine Supermarket and Hardware Supplies, Griffin Lane, Grenville. Convenient, because we are open Sunday to Sunday. We're even at your service on public holidays. Comfort, because we are easily accessible to the physically challenged. Free Wi-Fi is available while you shop, and bags come at no charge. Everyday low prices and excellent customer care. Adequate parking available. We supply everything you can possibly think of. Family and home supplies, fresh meat, vegetables, and personal care products. All brands of cooking gas at affordable prices. You can send in your order, have it pulled, or pick up express.
Welcome back, everyone. Welcome back.
Patients aware that you...
Okay, we're back, folks, and we are opening our telephone line to invite any calls from you. Of course, the number is 435-2041. So if you have any questions, we'll be more than happy to accommodate you. Dr. Nixon, do you want to come in here with anything for Dr. McIntosh or Mrs. Joseph?
Yeah, and I can just repeat what we just been talking about. You know, for all these years, when how long GPPA has been? 64 years. 1964. That's more than 64 years. Well, the truth is, I say it every day. We have 100,000 people on this island, and they were rain not falling. Okay, so with, let's say, half our population is female, and it's kind of like that statistically, right? And probably 20,000 of our women actually need that kind of, because we have young women, okay, and older women. Now, we have to find a way to integrate our services. We have to all come together and work as one. You do what you do best, I do what I do best, and we all do the best for the women. So if I choose to go to GPPA, and one of the things that we've just been talking about is that GPPA does offer you a little extra, nobody don't know where you're going kind of thing, right? That's how we are. We're private about these things, right? Your health center offers you, well, it don't really cost me much if it does cost me anything at all, right? But we have to use the services so that women, all our women, benefit. There's no service that's better than any other. Everybody is doing what they must and what they can. And together we will grow, we'll improve our services wherever there's gaps, wherever there's lack. One of us will come in, because it has to be a closely interlocked system that serves our women, whether it's pap smears, whether it's breast screening, whether it's doing VIAs, whether it's just plain old education and providing pamphlets. All of us have a role in doing this. And I hope that coming out of this Cancer Awareness Month, that we can actually collectively get together and work on a plan that takes in all of us, and we all do our work. And we look out for, everybody be everybody else's crutch, because that's what is going to benefit the women. One focus, and that is the well-being of a woman and the decrease of cancers among women's cancers. But I know Dr. McIntosh and maybe wants to talk about other cancers, because we get stuck when we think about women, we think about breast and cervix alone. Yes. And we have a whole lot more parts to us.
Yeah. But of course, because I also wanted to ask a bit about ovarian cancer in women. We tend to hear a bit of, issues with the ovaries in women and so on. So maybe Dr. McIntosh, you can probably just briefly tell us a little bit about that, ovarian cancer, what it is, how it happens, and how it can be treated.
Sure. So, like you said, first of all, understanding the anatomy. So I just want to briefly, for us women to understand, we have the uterus, which we'll call the womb, and which carries a pregnancy, and from which blood and tissue come when we have our monthly periods. The mouth to the uterus is the cervix. That's what's in the vagina, and that's what we see easily, and we have access to, right? And then we have attached to the uterus are tubes, which carry the egg from the ovary, which hangs right next to the tube, but it's not attached to it. And the ovary, when it ovulates, puts out the egg that goes through the tube. And if the person is sexually active, a sperm would meet up with it. It embraces, they have a conception in the ovum, and then that becomes pregnancy. So you now understand the full anatomy. So there's the fallopian tubes, the ovaries, the uterus, cervix, and the vagina. So the different types of cancer, we talk about cervix a lot because, one, we have all of these different things that can catch it beforehand, and we see the signs of it beforehand. Same thing for uterine, and hopefully we'll talk about that as well. Uterine gives a quick answer because it starts to bleed and bleed abnormally. So you would start to be able to know something's going on. Ovaries, they don't. They're small, usually about 3 to 4 centimeters, the size of a small lime, and they have 2. And when they start to have abnormalities, and we're going to ovarian cancer because there's so many different things that can happen with the ovaries, but when that starts, it is very difficult to know because it's sitting in the abdomen, so you don't have early symptoms. And that's the problem with ovarian cancer, is that when it first presents as a woman, it's usually by stage 3 or 4, which is very far across the ovarian cancer and difficult to treat. So ovarian cancer, there's a wide variety of the types of cancer based on the cells of the cervix. The symptoms from it are not readily available, so that's why we say do regular exams. even though you don't think anything is going on. But if your same doctor or healthcare provider examines your pelvis every single year, there may be a point where they may feel something and say, last year it wasn't this large, or I didn't feel this, or, this wasn't as large. And they may very well be able to send you for an ultrasound and may capture it. The other point is when you start to say, if you're postmenopausal or later on in age, and you start to note, unfortunately, these signs where you feel bloated, like you just can't feel comfortable, like you didn't really think you were gaining weight. You feel that you're losing weight, but your stomach is not getting any smaller, and you're noticing it's getting tighter and tighter, and it's just standing out there, and you're not pregnant, and you don't have fibroids because the last time the exam went, or you note that when you're eating, that your stomach gets full very quickly, that you can't eat as much, or you have difficulty with constipation, or you have difficulty and sometimes in the shortness of breath, or sometimes can be pain. Those are the signs of if ovarian cancer is there and it reaches stage 3 or stage 4, and you have ascites or fluid that has developed from it. And so it is a difficult cancer to diagnose. There really is no screening place. We have tumor markers, but that's after you have the cancer. So there's nothing screening that we can do for it, except that you be aware of what's going on. And if you have some general GI symptoms like I feel bloated, I can't tighten myself, or a family history where your mother or your sister or your grandmother, they say, yes, she had ovarian cancer, immediately want to come in. Or a family history of breast cancer, because there's the 5 cancers that go together: uterine, breast, ovarian, prostate, and colon. If you have any one of those, you can have any one of the others. So you want to be screened even more so for that. But ovarian cancer is a difficult cancer. It is probably one of the number one killers, especially in the first world countries, because of the lateness of diagnosis.
Dr. McIntosh, I just want to stop you for a second. You mentioned something there of great importance. Can you repeat that? That connection with the 3 different types. You have one, you can possibly have the other.
So there's 5. So there's uterine, ovarian, prostate, breast, and colon. They have the similar types of cancers that come out. And so you hear prostate and colon, that includes men. So that's why everyone needs to know the family history. And so if you have one of these, you may be at the risk for having another one, especially with breast and ovarian. You hear about people that have breast cancer and they remove the breast and then they say it's estrogen sensitive or estrogen receptor positive. That means that anything that makes estrogen will make this cancer come back. So they would say if you have breast cancer and estrogen receptor and you passed you're not planning on having children, sometimes they recommend to remove the ovaries because that's a form of producing estrogen. If you have colon cancer, then they talk about because of those types of cells, that is the risk that you can have uterine or ovarian. So you want to look at those. If you have prostate, the same type of thing. Being aware and the screening. And there's different types of screening. For colon, there's a colonoscopy. Uterine, as I said, it usually shows up with bleeding as the first thing. And if you have diabetes, overweight, women of color, postmenopausal, or very much there, you're at risk. Breast, the breast exam. Prostate, for men, if you have difficulty urinating or other types of problems and the enlargement of it, you start screening for it at 40. But those are the 5 that kind of group together that we talk about.
Okay. Dr. Nixon, you're muted.
And keeping in mind that men can have breast cancer as well. So that's one of the things that men must.
10% of all breast cancer occurs in men.
So.
Okay. Mrs. Joseph, let me come to you. As it relates to ovarian cancer and some of the other cancers that affect women, at your institution, do you do screening and other tests for conditions like those?
Godfrey, presently our focus is on breast and cervical cancer.
Okay. Wonderful.
But Miss Primus, do not sell yourself short, because even though your focus is on breast and cervix, the whole woman comes in, and from what I gather, you talk to the women. They come in, and so even though you're hearing, I'm coming for my Pap smear, but you have to ask, when was your last period? Oh, I haven't had my period for about 6 years, but then I just had bleeding. And so you would help them. So you do screen. You do, because you're talking with them. You may not be able to do the test there, but you're able to tell them, you know what, you need to get this test.
Right. That's correct, because we do referrals. So based on what we need to, we do a referral form and send based on what the patient presents. So thanks for that correction.
Okay, wonderful. Uterine cancer, Dr. McIntosh.
Yes, so that one, it's again, it's a difficult one too, just in the sense that women need to understand when you go through menopause is a normal state. You're pre-menarche, pre-period, then you have the point where you have your period, have children, etc., and then you get to the third stage of life, normal life. Because menopause is the next stage that's there before death. So I like to have a long menopause personally. I want to be here for a while. So when you're in menopause, that's when the body says, okay, ovaries are done. We're not putting out any more estrogen. We stop. The ovaries get smaller. The uterus also can start to shrink down because there's less estrogen. But you have women, sometimes you may, like I said, women of color, if you have diabetes can convert sometimes a little bit of estrogen that can affect the uterus. You're a little bit overweight, your peripheral fat can make estrogen and affect the uterus. And it starts to act on the uterus, which is called unopposed, and can start to change the lining of the uterus and cause you to bleed. First sign. If you're postmenopausal, and postmenopausal means that your period has stopped and the average age is 51. If it goes past that, you want to make sure every year you go into the doctor and talk about what my periods are doing. If it starts getting heavy at all, you want to be evaluated and have a biopsy, because you may have uterine cancer. Uterine cancer, usual presentation for the most common type is bleeding, abnormal bleeding or postmenopausal bleeding. And the diagnosis comes with taking some tissue from inside the uterus for them to check it. It is, because it presents so early, it is a curable cancer. Curable. And I want people to hear that. We don't want to keep carrying cancer and death. No, we live with cancer. We can live with cancer, and there's cancers that can be cured. So uterine cancer is one that you start to have abnormal bleeding. And I keep saying postmenopausal, but you can also get uterine cancer in women who are premenopausal. There's other types of cancers that occur. Because if you think about most women, 95% of us have fibroids, and fibroids is an overgrowth of the muscle of the uterus. However, there's sometimes a growth that can occur that is not a fibroid. Because fibroids are benign, not cancerous, and do not become cancerous, but there can be other growths of the uterus that can be cancer, which is called sarcomas, which can, again, is another type of uterine cancer. And then there's a few more. But again, the symptoms are what brings you in and go for the treatment for it.
Okay, wonderful. So, listeners, and our telephone line is open. The number is 435-2041. If you have any questions you would like to ask our guest, you can do so. The number again, 435-2041. Yes, you may have a contribution on experience. You just might be experiencing something that you probably not certain about. You can definitely give us a call, and we'll be happy to, of course, assist in whatever way we can. Of course, just bear in mind that our doctors cannot diagnose you over the phone, but definitely we can provide some information that can help you to make the decisions that you need to make as it relates to what you're experiencing. Dr. Nixon?
So, no, I just wanted Mrs. Primus to, GPPA is coming back. What do we expect of you? Where are you? What are the services you're offering to us?
So, GPPA is coming back. What do we expect of you? 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 What do we expect
In regards to GPPA recommencing services after 2 years of being closed, we are back with all the services that we had prior and additional. So services such as you need your depot injections. This is the one that is offered every 3 months. A woman would need to get it. We also get in the 1 month and 2 months injectable. That will be available soon. We have condoms. We have the IUD, the copper available. We also be getting the hormonal ones very soon, and so persons will have that option. We also have the microlute and the microgynon, the single hormone pill and the double one. So that is also available with additional screening such as fasting blood sugar, or you just need to get a finger stick blood pressure check. That is, you can get a pregnancy test. We have the emergency contraceptive pill available also. So we would want persons to contact us by calling 440-3341 or 403-3341, or you can also contact us on our Facebook page via WhatsApp. So we just want persons to know that some of the services, such as the insertion of the IUD, the pap smear, breast exam, you need to make an appointment. If you walk in and we do have available space, we will accommodate you, but it's best to make an appointment. You can walk in to get the injectables or the pill or to buy condoms. We have both male and female condoms. A lot of persons try to imagine how a female condom is, how do you use it? It is amazing from what persons who used it, especially persons who are experiencing dryness, like they're going through menopause. The female condom creates this additional sensation and moisture, and you have advantage of putting it on hours before the date or whatever you plan to do. So it's something we want persons to be aware, because it's not just the male, but you can have female using those condoms to help. So it's available and much more to come. So we want persons to know, reach out to us, and you're coming into an environment very confidential, very, very comfortable. It's like you're walking into your own home and friendly staff, and you have that reassurance that whatever you come to do will be kept very confidential. And this is what GPPA is known for, and we maintain that aspect of it. So please call and inquire. We are here to serve everyone.
Mrs. Joseph, I need to get you back on the program a little more often. There are a lot of things that you say that I'm interested in. But
where are you located?
We are located in the Ponte Street, also known as Cockroach Alley. So when you're coming from St. John's Daycare Preschool, from that end, you can drive in one way, or you can walk that end, or come through from Marketdale and walk. The building, you wouldn't miss it. It is orange and blue. The signs are well displayed. You can see it from any end.
So you walk up halfway up Market Hill and you turn left?
Yes, the Ponte Street is right there. And
so that's Cockroach Alley.
Yeah, but I've never seen a cockroach there from, so I don't know where the name come from.
I couldn't figure out why.
Mrs.
Those of us who live in town for a long time, that's Cockroach Alley. I went to Heinz School, okay?
Yeah. Mrs.
Right.
Primus, someone on our WhatsApp platform is asking for you to repeat the numbers of your office.
I'm sure. The landline is 440-3341, or you can call the cell at 403-3341, or you can meet us on Facebook, Grenada Planned Parenthood Association.
And for those of you looking at television, if you just look to the side of Mrs. Primus, the number is there. That's where I saw it and I wrote it down. Actually, it's very, very visible. So you can't miss it. You can't miss it at all. All right. So the number 435-2041. The telephone was going a while ago.
I wanted to. Your telephone start yet? I wanted to ask Dr. McIntosh about the services in the public sector, because they have been active, and what else are we going to be doing here? GPPA talking about other things, looking for screening for breast cancer and stuff. We've been a little dormant, and understandably so. What is happening in the government sector?
So again, he said it has been dormant because of the COVID, and they had to set it, especially in the community health center. The nurses were the ones that were going out doing the COVID testing and COVID tracing. So now they're coming back in. So we have within the community health, you have all the different types of clinics. So you have a prenatal clinic, you have what we call the VIA clinic, which is for cervical cancer screening, and that's again, you need to know it's in Grand Bras, St. Patrick's, as well as in Carriacou. And then they also have the pap smear clinics, which are done pretty regularly, along with the postpartum and prenatal. They would also do a pap smear during those times. You also have the clinic for children, and then the general diabetes, hypertension, those types of clinics that are there. So there's a lot of different types of clinics that are going on. And as you talk about accessibility, there's one thing that we found just when we were doing testing and vaccinations, going out into areas that you don't even hear about, is people are not necessarily coming into the clinic just because of the length of place that they have to get to. So there's the times when it's needed, which the community health nurses try to do as well, but it's difficult to leave your clinic and go make home visits. But they do try to have that type of thing so you can get more access to people. Once you also have that, you also have the clinics within the general hospital, as well as the Princess Alice Hospital, where if you have like further advanced, so like we need prenatal care and you're a high-risk pregnancy, perhaps you have diabetes that's diagnosed during the pregnancy, or high blood pressure that's diagnosed, or more advanced age or multiple pregnancy, then you're referred back into the general hospital. So you're seen by an obstetrician gynecologist there at the general hospital. So those are there. And then, of course, like the different health fairs and joining with, as we say, our partners, SGU, where the students go out and we used the mobile units and also gone out with the BIA nurses. So there's a lot that's available. You hear we hear with the Planned Parenthood down in St. George's that it's there and it's available. It is the awareness and access that we want to, all the different types of access. And, confidentiality, yes, is an issue, but let me weigh it. Yes, you're going to find out about me going to get my pap smear. Well, then that's good because I'm taking care of myself. You're not necessarily going to hear my results unless I tell you my results. And even so, sometimes it may be helpful to tell the results. The hairdressers, the beauticians, at the worthwhile place while you're doing the hair, talk about the pap smear. Ask somebody, did you get a breast exam? Those are the different things. So when you go in, make use of when you go in and make your healthcare provider, which a lot of times are the nurses, stop and listen and hear what's going on with you, and it may pick up something else that's going on. So those are going on. We wanted to expand the BIA clinics. In Carriacou, it's a matter of going out there. So, again, Dr. Donald, our Director of Medical Services, is now restarting that to have people go out to be able to offer the clinics out in Carriacou. We go up to Princess Alice as well. Mount Gay, we cannot neglect to talk about mental health care as well, which is extremely important because that gives you the base in being able to manage some of the different things that's going on. So at Mount Gay, they have their clinics there as well.
And of course, we still have our general practitioners, and the fact that everybody probably lives within 3 miles of a primary care clinic.
Yes.
Everybody lives within 3 miles. We still have a little space, okay, guys? And it might seem long, but please, let's make use of this. Is a gift that we so intimately related. They claim Grenada has the best roads in the best road network in the entire Caribbean. So anywhere you go, you can go somewhere else. It don't matter where you live, you will find a clinic within 3 miles. So we want to remind people that you also have to take that power on, especially your women. Take on the power. You do everything else. You almost run the world. See, 3 women here on tonight. Godfrey, sorry, but we're here. No, we're here.
No, Dr. Nixon, I'm honored. I don't want to end the program. I feel very honored.
But seriously, women take on a lot of responsibilities, even with all the disadvantages. Women generally in the world earn a lot less. They have the secondary jobs. I mean, here we have women leading. Dr. McIntosh, Mrs. Joseph, leading in the agencies. In the Caribbean, women get an opportunity to lead. We want to take everybody up with us, especially when it comes to your care, how you care for yourself. Take on that one power. Yes, you might have to take the kids to daycare in the morning. You might have to be the one to get into the office early because you're the cleaner or you're the cook in the school or whatever it is. But you also have a right to care for yourself, a responsibility to ensure that you use the services that are available to you. So don't be afraid.
Right. So, folks, I know the phone has been going and we've been missing the calls. Yes, it has been going, but we've been missing the calls. But it's important to get information out there. Dr. McIntosh made the point earlier that education is so important in all of this that, I believe people are really paying attention. In fact, 20 minutes into the program, someone sent me a WhatsApp message saying to me, the program is just 20 minutes and it's already such a good one. Those were the exact words. And that happens when people, they feel empowered. They feel that, look, I'm gaining information that can help me to do something about me. And that's very, very, very important. So, folks, you can call now. The number is 435-2041. We still have a little time on the program and we'll be happy to accommodate you. So those of you who are trying to call, we do apologize, but you can definitely do so now. The number again, 435-2041. Yes? Please.
Can I make a little push for the COVID vaccine, especially for people with comorbidities, diabetes, hypertension, and pregnant women? It has been devastating pregnant women who have gotten COVID who are not vaccinated. COVID affects the pregnant one person, and that will then affect the pregnancy. The vaccine goes to the woman, doesn't go to the baby. But if you protect the woman, you're protecting the baby. And so really push for all pregnant women to consider that, as you are now the carer of a child or a child to be, consider getting the vaccine as well as the booster, and also the same thing for people with diabetes, hypertension, over 60, overweight, all of those, because COVID will put itself into that place.
Okay, so let's
include women who are planning to get pregnant.
So Dr. Nixon, yes, let's go to the telephone now and see who's with us. Doctor in call, good evening. Hello. Good evening, caller.
Good evening.
Yes, can you turn the volume of your radio or your television down?
I'm the TV here. I'm talking to you. Turn on the TV. Yes. Okay, give me a minute, please.
No, you need to listen to me on your telephone. So turn down your yes.
Yeah. I would like to know what part is where is the office for the GPP?
Okay, so it's on Mrs. Primus?
Yes. Grenada Town Parental Association and GPPA is located in the Ponte Street. It's also known as Cockroach Alley in St. George's. So it's easier when you're coming up to Market Hill, you take a left, and the city office is right on the road. So you're coming from St. John Street and you're coming through to the street that ending up on Market Hill. That's where GPPA is.
Oh, on top of the Market Hill.
Well, actually, it's, let's say at the middle. So at the middle point, if you're coming down Market Hill, you actually take a right turn.
Mm-hmm. Yes. There's only one street. Yes. There's only one street that crosses Market Hill, and that is Cockroach Alley or the Ponto Street.
Okay then.
Okay. So it doesn't matter where you're coming from. There's only one street that goes across Market Hill that takes you onto St. John Street, in the middle of the hill. When you're coming from the top, you turn right. Coming from the bottom, you turn left.
So any part
are you also planning on opening up a branch in Caracou?
It is every day.
That is futuristic, of course. I do not want to leave out my Caracou people, never. So futuristic.
You guys trying to keep your visa?
Okay.
Just before, I think the caller was also asking about your operational hours. If you operate like the days and the times.
Okay. Right, GPPA, we operate 8 to 4, Monday to Friday for now, as there will be plans for extension, so we can accommodate persons who work in and can't get the time Saturdays or let's say to 5 o'clock, just to accommodate persons to get access.
Okay, wonderful indeed. Yes, so you were about to say something just before I interrupted.
Yes, I think I left out, GPPA do offer antenatal and postnatal services, and we want persons to know that they can come and get that service. And I would take the opportunity to say, you have an appointment, you take about half an hour and you're gone. You could go back to work, so you won't have to stay for the day.
Mrs. Primus, you antenatal and postnatal, what do you mean by that? I'm a man. I don't know about that. So
don't worry. I will explain. When someone is pregnant, they just find out that they are pregnant, they need to be monitored and screening tests need to be conducted. So to ensure that they have a successful pregnancy, the outcome is positive. So the earlier that you know, the earlier that you should get the necessary assessment and blood tests and weight checks, everything. So in case you do have any complication that is not needed, then you can get the proper treatment referral and have that case proper management of the, so you have a positive outcome. So post natal is 6 weeks after having the baby. Mm-hmm. The mother needs to be assessed and to make sure everything is well. Also, the baby is needed to be assessed. So yes, it's available.
Okay, wonderful. So antenatal is during the pregnancy, the care,
right? You're pregnant,
and
yes.
Postnatal is after you have the baby.
After the baby, the 6 weeks check.
Right, wonderful indeed.
And not to forget, we do offer psychoeducation, counseling for gender-based violence, specifically if you're one of those persons experiencing that, or just general counseling. We have that, and I must say it's available right now, free, of course. So persons can reach out and to get that support that they would need.
Okay, wonderful indeed. 435-2041, that's the number, folks. You can call if you have any other questions or you would like something cleared up that you probably didn't understand. You can definitely do so. We have time for probably about 2 or 3 more questions. We'll try and take them in. If not, I will ask our guests to probably wrap up by making some closing remarks, and we can start with Mrs. Primus.
Thank you for having GPPA as represented on this program. We look forward for future programs, because we do think persons need to know what is available, and when persons are given the right information in regards to their health, they do make the right decision. But as a health professional, you need to have that skill set that you're able to break it down to the level of the client that you have in front of you. So you speak the right, use it layman term. I use my 2 fingers and explain about high blood pressure, why the person need to take the meds, and that was it. They really did understand. So you just need to be able to assess and make sure when you are speaking to your clients that they do understand. Ask them to explain in their own words what they understand or what you are saying, and then you can build on it. And sometimes we need to look at the amount of information that we are given at that particular time. So we can offer support like brochures, or they can have the choice to call, use WhatsApp, whatever. Make use of the media that we have and ensure that our clients are able to gain access from the reputable sources. There are so much things out there. Make sure that the information that you are getting is very personalized, so you can, to your doctor, your nurse, GPPA, whatever, but make sure that information, because you can't find anything out there. So be mindful of those things. So we just want to let everyone know that GPPA is here to serve everyone, no matter age, race, class, sexual orientation. We are there to offer that service for the general population.
Okay, wonderful indeed. One quick thing, Mrs. Primus. There are fees associated with some of the services that you offer. Of course, you have to run the office.
Right. GPPA is a non-government organization, non-profit also. So our services are highly subsidized by the International Planned Parenthood Federation. So yes, we do charge a small fee. There are times when persons who need the service, they come and we have projects such as PAHO and other projects that they can get that access to the service that we provide through those projects when it's available. We also use a lot of educational sessions. So in the previous months, we had sessions on menopausal symptoms because a lot of persons are struggling with that and don't even understand what's happening. The partner do not understand in the workplace. So getting information, and the women really did appreciate it. So because of that, we know we could look for other grants to push more using virtual in the house, right right now, like that. They got information. So we had different personnel doing those sessions. We had comprehensive sexual education for out of school youths, and I must say it'd be amazing. The myth about teaching youths about what is sexuality and what it is and the do's and don'ts. When we think giving them that information would make them want to start having sex, I think is a reverse, because they now understand that in making that decision, it's on them, but they must make a well-informed decision and understand the pros and cons. And they must have been say, I'm not ready for what sex has to bring. So we need to have that conversation and do not, this is life and information is out there. Make sure that we give our youth the information to empower them. So this is one area that GPPA is really trying to get into. So giving persons information, they know what they can do to protect themselves from, in the end, you have less case of cervical cancer. It has a very good spin-off, and the outcome could be really good. With information, persons make informed decisions. So this is where GPPA feels.
Thank you very much, Mrs. Primus. It was indeed a pleasure having you on the program, and I will be calling you again pretty soon.
Thank you. I look forward to that.
Yes. Dr. McIntosh?
Again, I just want to first say thank you for having me as well on the program. And again, it's a pleasure to be with Ms. Primus as well to talk about the care. I think, again, it comes back down to the point of providing education, making people aware of all the services that are available to them. And for women to understand, to know their own body. Write down when you have your periods, keep that marker, keep it on your phone, keep it on a calendar where you can. Take note of how things happen every single day and note that is the normal. So when abnormal comes up, you will be able to address that. But come in for your regular preventative care. You have all these different options in the clinics, private doctors, DMOs, the Planned Parenthood. You have places that you can go to. So go to where you feel most comfortable, or go to the place where you think that you will be heard. And when you go in and understanding you're going in as a partner with the healthcare provider, that you're going to come with your questions, write them down beforehand, because sometimes we may not remember. For women, for gynecologists, we always like to know when your last period was, and no matter what type of period, and for you to be able to describe it. We also want to know if you're sexually active or not, because we can talk about different types of birth control that's available, and also if you're in menopause or not, and sexually active, and what we can do to assist you for any problems that may arise. So know that that's what's available to you from an OBGYN or nurse, as well as a doctor, that you have those particular things. And then the one thing is, fear comes because of the unknown. Come and ask your questions. Take a look down there so that you know what it is, and then you can ask the questions about that. Do your breast exam. In fact, examine your breast every single day for the first month to know how your breast feels before your period, after your period, during your period. And that gives you an idea of understanding what's going on. Also include even your partner, because your partner, he might notice, whether it's he or she may notice something as they are there with you and living with you, may say, I notice a discoloration. here, or you might this area in front of the vulvar is now pink. What's going on? And if you notice a discharge, come in. I know we want to don't douche. Please don't douche. There's no reason for that. Our vagina takes care of itself. If you have any abnormal discharge, odor, green, yellow, bloody, etc., or have itching, come in for it to be evaluated. And so those are the general ones, but come in for your preventative care. Come regular for your regular pelvic exam and perhaps pap smear, or even not, but just to come in. You will get your breast exam, have your blood pressure checked, you can have a glucose check. So you're just getting a full exam as you're coming in. And notice you keep doing that until you're 6 feet under. Continue with that and come in early. If you're planning a pregnancy, plan the pregnancy. Don't just wait for when you're pregnant to start, but plan. Start with the prenatal vitamins, etc. And really, I push for it's in the clinics that's there, then in the hospitals, and I would give that the Ministry of Health, we're now being able to provide more and more services. Be aware of that and take advantage of that. Don't be frightful of it. Don't be frightful of COVID, so that keeps you away. Come in and take control and really support these programs where it is. Providing the education to help you to be empowered, providing the education to know what questions to ask or even what to look for. And remember, women, we are amazing. We are the central. We're not the givers of life. God is the giver of life, but we're the ones that carry life through. We're also there to hold the man together, hold the children together, hold ourselves together, and still look good at the end of the day. So understand that yes, we are wonderfully and fearfully made, and we should embrace that and be proud of ourselves in that. And in being proud, then you want to take care of yourself, take care of your beautiful temple. And each and every one of us are beautiful. Each and every one of us.
Dr. McIntosh, as you were talking, something just came to my mind. You mentioned a lot about, what women should do and all of that. Do we have any role? Can we assist in any way? I'm talking about the males, we guys. Can we help in any way?
Yes, you can. In fact, it may very well be that you may want to come along with your partner to the gynecological exam. I've had where men have come in with their partners, and they, we allow, I really like to speak to the woman by herself, but then they allow for the man to come in. And then they would ask, because sometimes the man would say, I noticed, we talk about birth control, because men will say, shucks, you're going to put in an IUD. Is that going to, oh, shucks, I'm not sure we can say all this on the TV, but on the radio. Is that going to touch my penis? How's that going to affect me? Or if she's taking that birth control, does that affect me? So they have those questions, and that would mean I'll be supportive, and the woman can be supportive to them, because when they're saying, I'm seeing her go in, I need to get checked as well. 10% of breast cancer is in men. I need to get checked as well because I may have some abnormality. I need to get checked. The HPV, well, maybe I need to get the vaccine as well as a young male. And also, if she has an infection and I'm sexually active with her, I too have an infection and need to get treated. So yes, you can be supportive, but then also take note of how she's going in. I need to go in for my preventative care as well, and let us go as a family and support each other in that. A lot of women will come in when they talk about finding a breast mass. It's not them that's finding it, but it's their partner or their husband that they say has picked that up and brought me in. So you can see how that is. And that is when you're intimate with a person and you love that person, then you should have nothing that stops you from having that discussion and being proud of being able to say, how do we work together in keeping both of us healthy?
Okay. Thank you very much, Dr. McIntosh. It was such a pleasure having you, and I'm looking forward to having you again. I usually say to people, once you come on this program, there's no getting away. You will be back. So rest assured, you will be back. Dr. Nixon, we're getting ready to wrap up. Your final, your closing words.
Yeah, you're saying the fat lady must sing. Okay.
Oh, she has to.
So, I want to thank my colleagues, because we all in this together. I want to thank you, ladies, very much for opening our eyes further and for contributing to the closure of this gap. Because if our women can go and get screened early and use the facilities, there's so many facilities that are there, we're going to have better outcomes. We are. If women would encourage their girls to go and do the same thing, teach them from small. Because healthy women start up as healthy girls that come from healthy pregnancies, that were healthy women, that were healthy girls that came from healthy pregnancies. We really want to encourage that kind of cycling, okay? You can't be a woman who has uncontrolled diabetes and expect to have a healthy baby and be able to take care of a daughter during her life. We want to make sure that women work on their general health. And of course, general health with the object of preventing whatever disease they have control over. Cancer is one of those. And this is still Cancer Awareness Month. You know, we say one hand can clap, and that's very true. Sometimes you need to have a big applause, and you need a lot of hands. And here are the hands. We have GPPA, we have the Ministry of Health and all its facets, the primary care clinic, the DMOs, the nurses who do VIA. You have us at the Cancer Society. We're going to collaborate with you and get out in the communities. You have community-based organizations. You have SGU. You have your GPs. You have your other private services, wherever you go, your gynecologist, wherever it is. And we have services. We have access. Do we have PET scans? No, we don't. But we still have ultrasounds to do our breasts. Do we have highly contrasted whatever radiological investigations? No, we don't. And so we're asking us to remain good with basic lifestyle, basic healthcare. Use the things we have, because those things that we have are the things that we always had that everybody else has. What they have in America might be better for when you're sick, but we're not going to get sick because we're going to take this thing on seriously. We are going to empower ourselves as women to ensure that our health status is great. Women are, look, everybody I see have one of this, and nicer ones and mine are more expensive ones. Google it. You can't get information? Ask one of us. There is no stupid question. There's no question that's stupid. If it sounds stupid, it's because you don't have the concept. Somebody has the information in their head and is always willing to impart knowledge. Don't be shy, okay? Don't be shy. Ask questions. Ask questions to anybody that's in the health services. All of them are supposed to know anyway. So use this to empower yourselves. And of course, you talked about the men. It is important because our men often encourage us because they want us there as their partners. And I'm going to ask our males, yes, keep on encouraging your partner. Those of you who don't do it, get on the program. But they often encourage us to take good care of ourselves because they see how we work hard. They see how we are after we have a baby. They see how much we don't sleep in the night when the twins and the triplets crying. They see all of that. They see how you suffer during heavy periods. They see how you suffered when you discovered your breast lump, right? Our men are part of this whole game. Encourage them. Don't cuss them and go on. And encourage them to go get checked, you know? Again, let's all take care of ourselves, our health, and keep ourselves. The other thing I want to raise on its own is the issue of vaccinating our girls against human papillomavirus. They talk crap, those who tell you negative things. I'm not making any apologies. The Australians will tell you that their cervical cancer rate has dropped to almost zero. They hardly have new cases. Probably 1% of what they used to have in the past, right? Of new cases, simply because their vaccination against human papillomavirus, which causes 99.9% of the cancers of the cervix, right, has worked in their population and prevented the appearance of cancers. You have boys, give them to get their vaccines too. There's a reason for that, because they too will probably have intercourse with somebody who has HPV, whose mother didn't think it was right to give her the vaccines. So let's protect our children and our future generations, right? Cancers are our unfortunate part of our health heritage, and we as a collective of 110,000 people, when the sun shines in, are going to fight this together, tooth and nail. It doesn't matter who we are. We're going to come collectively, and our population is going to work with us, because our only objective is to keep us all healthy and well for a long, long time.
Dr. Nixon, thank you so very much. Just before I go, I just want to let our men know that, sometimes when we hear of GPPA, we think, oh, well, that's for women. No. It's for everyone. Well, when I say everyone, I don't mean children, adults, male and female. So guys, fellas, you can visit the GPPA, talk to Mrs. Primus and the other, healthcare providers there, and they will be able to give you answers and to provide guidance for you as well. All right? Because, a lot of things that affect women can affect us as well. So you can visit the GPPA. Don't forget the numbers again, 440-3341 or 403-3341. Mrs. Primus, I got that right? All right. Thank you very much. So, ladies, I thank you so very much for accepting our invitation to be on the program. Dr. McIntosh, Mrs. Primus, thank you so very much. And I'm really looking forward to having you again, because that's the kind of conversations we need to continue having to help us as individuals. So I thank you very much, and I look forward to having you. Dr. Nixon, you know how much I love you. I never tell you thanks. You always here with me. Thank you so very much.
Make Karina hear you tell me that you love me. Go on.
No, that's all right. That's all right.
And I'm not doing the second fiddle thing, so you know.
Folks, that's our program this evening. We thank you so very much for staying with us, and of course we look forward to having you next Tuesday as we continue our cancer awareness campaign. So thank you very much, and do have a good night. You can join me tomorrow evening from 8 o'clock for our Wednesday evening edition of Release It. We'll have an open line, and so we continue our discussion. Thank you. Have a good night. All the best.